first of all, I want to thank you very much the opportunity to share with you this motivation for my candidacy for Women at Large WONCA World, and with the special interest in the World Health Organization liaison position, because I think is there where I can be an essential help to promote primary care and particularly family medicine in the development of different projects in the WHO organization. So I introduce myself just to remember that I am a professional mixed career, because I'm a preventive medicine and public health specialist and a family and community medicine specialist too. So my first stage was as large hospital manager for almost 15 years and quality and safety hospital coordinator until 2006. And the second stage, I did the family and community medicine residency again for 4 years and became a family doctor in rural area and then urban primary health centers where I am now. As teaching profile, I've always been an associate professor of the medical school at the University of Zaragoza. First, I've been a preventive and public health teacher, and then I became a family medicine teacher. And I teach and be a mentor of family and community medicine residency program at the Public Healthcare Service of Aragon. So my common motivation along my professional career has been quality and safety overall. I try to develop these two common motivations through the linking of the work of scientific societies. I belong to the Spanish Society for Family and Community Medicine, and I have been the honorary secretary for many years of the Spanish Society for Healthcare Quality, which joined the ISQA society as well internationally. Well, as I said to you before, I started working on healthcare quality, but at the end, I focus my career on patient safety as the minimum level to guarantee in every patient contact. I started in 2005 to create the Patient Safety Working Party of the Spanish Society for Family and Community Medicine, and I've been chairing it since 2011. We have developed a blog where we try to offer information about primary care and patient safety, especially, and we celebrate an annual conference on primary care and patient safety, and this year we have already celebrated in June 20 and 21 the 13th conference, just to introduce patient safety culture among primary care professionals. My participation in WONCA started with EQUIP, so I'm really linked to EQUIP as an essential group to learn and to share ideas for quality and safety. I started to participate more actively in Prague in 2016, where I had the opportunity to present our first study, the Spanish Medical Office Survey on Patient Safety Culture, then in 2017, Second Victims and the Prescription, Bratislava, Thessalonica, where I have introduced different research objectives and as well some of the World Organization project, which I, with the WONCA Party on quality and safety, we try to promote in every conference or in every workshop where we work. And I want to mention especially my link to the EQUIP Summer School in France, because I've been participating the last 5 years, and it's always a very interesting and very charming meeting where we have close contact to family doctors who want to improve their own practices, and we are able to share ideas and small things that may provoke or may lead to big changes. So I want to thank you, Isabel, her invitation to participate there and enjoy with all of them. Then I started to participate in WONCA Europe conferences. I first participated in 2009 with a patient safety culture workshop in primary care, and then in different other conferences, always with both topics, patient safety and quality issues, and as well improving clinical reasoning in medical students, what is another of my research interests, because I'm teaching this topic in the Faculty of Medicine in Zaragoza. And through WONCA Europe, I led to WONCA World. I start my first attending in a WONCA World Conference in Seoul, and was the first and now the only one. In Seoul 2018. It was an amazing experience. I met many people from many regions, and I was able to connect with people that joined the Quality and Safety Working Party, because I didn't have the opportunity to be in Rio de Janeiro, where I was elected as a chair of the Quality and Safety Working Party. So the very first 2 years I worked online mainly, and in European conference and equip, but not in a WONCA World conference as in Seoul. And then there in Seoul, WONCA president and WONCA CEO proposed to join the advisory committee on WONCA family medicine and practice accreditation. So I have been working in that topic for the last years, and we recently did 3 practice accreditation in China. Firstly, an online visit, and then we will do the face-to-face visit. It was really interesting because I'm engaged in practice accreditation in my country, and particularly in my region, as an International Society Office internal auditor for primary care. So I'm learning a lot of things, and I think it could be a very interesting proposal to go on, not only depending on enterprises or that are linked to accreditation, but to develop our own procedure and with our own knowledge about family medicine and primary care. So through the Working Party of Quality and Safety, I have the opportunity, that was really a gift, to join World Health Organization. WONCA asked me as a chair of the WONCA Party to start to participate actively in the creation, designing and development of the World Patient Safety Action Plan 2021 and 2030, which we started some years ago. It had been a very interesting adventure just to get to the new plan. It started joining different challenges. The World Health Organization have different challenges along the time. We started with clean care is safer care. So we developed the 5 moments for hand hygiene and the point of care, because the World Health Organization at the beginning only developed it for hospitals, and we collaborate to develop it for ambulatory care as well. And then I think the more interested challenge for primary care, that is medication without harm, as medications are the first cause of patient safety incidents in primary care in the world. Then we collaborate as well in the technical series on safer primary care, and just to promote these reports and to help practices to implement them. And finally, I want to introduce very briefly the final document of the Global Patient Safety Action Plan 2021-2030. And the Working Party, we have worked several ideas, and we have sent feedback to the World Health Organization on primary care issues. The fact is that World Health Organization headquarters asked specifically to send them some ideas on where to work. We are one of the partners in actions, both parts, just as healthcare facilities, primary care facilities, and as well as stakeholders. So my proposal is to work in these two areas, just to promote that primary care facilities can propose ideas and suggest strategic actions to develop in primary care, and we as WONCA support them and try to push to implement them to the health authorities. This plan is organized in 7 strategic objectives and 35 implementation objectives. The main 7 ones are policy to eliminate avoidable harm in healthcare. We as primary care workers need to afford these, and sometimes we need some particular regulations to protect primary care as well. Then to develop high reliability systems is sometimes healthcare politicians said that hospitals are reliable system, but we primary care as well, we provide sound and scientific based care, and we try to do it with the best equipment and resources as possible. So we have to be there to improve. Then we design the safety of our clinical processes, as we have been talking about the COVID pandemic, how practices are developing by their own safety clinical processes, and trying not to let no one behind, not only COVID patients, but non-COVID patients as well. Then how we can engage patient and family. We really in primary care work with them, so to improve health literacy, particularly regarding their safety, as some of you have been comment. Then health worker education, skills and safety. We have been talking about it as well. So I'm collecting plenty of ideas just to have the opportunity to share with them. Information, research and risk management, our reflection on the pre-COVID study and the possibility to develop it in the equipped next meeting will be really challenging, and we can offer to the World Health Organization, as Sarah Williams said previously, and to the European Union, some roadmap to go on working. And then the synergies and partnerships and solidarity. Specifically, primary care mention is only in the 3rd strategic objective, that is safety of clinical process. And the mention of primary care is patient safety in primary care and transitions of care that we have been talking previously. But I think my objective is to highlight the role of primary care, and particularly family medicine, to provide a safe healthcare in all the global action plan, not only in that point, but to introduce that the rest of the strategic objective has a view from primary care, and we have to focus on the main areas that may lead to a safer and quality healthcare in this level through family medicine. Then just to share with you some of my essential textbook to learn, that was the Safer Healthcare from Charles Beeson and Renee Malberti. But recently in February 20 and 21, it was launched the textbook of patient safety and clinical risk management. Is mainly oriented to new professionals in different specialties and written by them. And it's really interesting. It has a chapter about non-clinical skills to improve patient safety, and you can download the book free from the web page of Springer. It's an open access, and I recommend you to read some of the chapters that are quite nicely written and give us some new proposal to improve patient safety, not on, well, in hospitals and in primary care, in all the healthcare system. Then just to share my personal background, I'm married with Jorge, who is a high school Spanish literature teacher, so no medical contact. I have 3 children. Leticia, she is an internal medicine resident in Barcelona, in the northeast of Spain. Lucia is an early childhood teacher, now working in a school in Helsinki, in Finland, and Juan is a physiotherapist and physical trainer in Lérida, which is a city quite close to Spain, to Zaragoza. So this has happened during the last 2 months. So when I was listening to you about new childs have been born and are at home and all these issues that remember me my times ago and now, I have to say that in 1 month, the 3 are living their lives abroad, and we are starting a new step in life as well. And hobbies, cultural activities with family and friends. I love to go to theater and cinema, running outdoor, of course, with all people who want to join me, listen to music and reading, dancing. I love dancing, and traveling. So this is my small flyer that I prepared just to share with you and with the rest to support my candidacy and my objectives. And finally, in my professional journey to this position, I have to give special thanks to my colleague and friend, Jose Miguel Bueno, because we have been working all those years together, and I have been really wonderful experience. So I want to express my sincere gratitude, and to count on him as well during the next times. And to all of you, thank you very much to all of you. I'm learning and enjoying every time we meet. We share primary care experiences, but particularly your positive spirit to improvement opportunities I will have been discussing today. So my focus is not leaving no one behind, and trying to work together. And even though we are slowly, but together we can be essential. We can make an essential change for primary care. So thank you.